Hi, my name's Tom O'Brien of the dr.com, thedoctor.com, and I'm here at the Longevity Conference, Vibrant's first longevity conference, and we're just having a wonderful time. My experience of this first longevity summit is first the caliber of the attendees. They're well-trained, smart clinicians. They know a lot about integrative or functional complementary medicine already. And the conference itself, I don't think I've ever been so well fed as I am here. Well, the evidence is clear. The longevity market, if we refer to it that way, is growing and growing and growing. Dr. Isaac Jones' presentation of all the companies that are in the longevity space with nutrition or equipment or exercises, but there are many, many companies now that are focusing some percentage, if not all, of their efforts in the world of longevity medicine. Some of the attendees, I think it's the first exposure to some of these concepts. For others, it may be reinforcing some of what they already knew, but for all of us, there was a lot of new information that was very valuable. What I was so thrilled in January of 2016 when Mayo Clinic published, and they called it a new era in laboratory medicine. This is Mayo Clinic. Mayo Clinic calls it a new era in laboratory medicine with 97 to 99% sensitivity, 98 to 100% specificity. What? It means you're right on the money every time, without exception. And all of the other tests out there, as far as I know, is between 75 and 85% sensitive and specific. So it's a new era. When would you ever use a less accurate test? For convenience. Because, if you get a new test, you have to learn how to interpret it, and doctors are busy. But when you take the time to learn about this technology with Vibrant, it's a game changer. In South America, North America, Latin America, Europe, where I teach, there's no test like it in the world. The wheat zoomer looks at 26 peptides of poorly digested wheat. Every other lab looks at one, alpha-gliadin, maybe two. Maybe they'll also do deamidated gliadin, and they think that's cutting edge. Well, it was in 1998 when the papers came out on deamidated gliadin, but that's 25 years ago. So many patients who have had the regular tests done at hospitals or from their doctor looking for sensitivity to wheat, and that test is alpha-gliadin, maybe including deamidated gliadin, and it came back negative. And they said, but doc, I don't feel good when I eat wheat. Well, look, here's the results. It's all in your head. That doctors make up stuff. They make it up, and they're wrong. That it's not all in their head, it's all in the test. The test was not comprehensive, and the wheat zoomer is the most comprehensive test I've ever seen on this topic. So when you have an accurate test looking for sensitivity to wheat, is your immune system fighting this? And you also have the test for leaky gut on the same panel, competitively priced. When I saw that, I was not only tickled, I said, I've got great respect for the business side of what they're doing here. It's a new lab, but that was a smart move, putting those two tests together, so doctors don't have to charge a patient twice for the leaky gut. And all disease begins in the leaky gut. We know that's being taught at Harvard right now. All disease begins in the leaky gut. So doing that test with the wheat zoomer was brilliant. Every patient that I see is going to get a wheat zoomer and a neural zoomer plus. How long have I been using Vibrant tests? It was January of 2016 that a paper was published where Mayo Clinic called it a new era in laboratory medicine. And they were talking about the wheat zoomer. And I read this paper and I was like, oh my God, this is fabulous. No longer are we going to have the false negatives in testing that we were getting, unfortunately, too often. And I began using the wheat zoomer in January of 2016. And I've been talking about it to my colleagues and friends ever since.